BPA, or bisphenol A, is often found in thermal receipts, and well, it can actually be absorbed right through the skin. Children are particularly at risk here because their bodies are still developing and, they tend to absorb more of these chemicals per body weight compared to adults. BPA acts a bit like estrogen, which is the main female sex hormone, by binding to estrogen receptors in the body. Now, in children whose hormonal systems are still maturing, this kind of interference can lead to some significant problems. For boys, BPA exposure can lower testosterone levels, which might affect genital development and even future fertility. For girls, it could trigger early puberty, breast development at a younger age, and irregular hormonal cycles later on. In both boys and girls, BPA exposure can disrupt thyroid function, which is really crucial for things like brain development, metabolism, and growth. Studies have shown that exposure to BPA during pregnancy and early childhood is linked to changes in hormone-sensitive tissues. BPA may also have an impact on brain development, especially if the exposure happens during infancy or early childhood. Some possible effects include a higher risk of ADHD, increased anxiety, aggression, or even depression-like behavior. Children might also face learning difficulties, memory issues, and trouble with impulse control and focus. Both animal research and some human studies have found links between BPA exposure and neurodevelopmental delays, as well as behavioral changes. Since BPA interferes with the endocrine system, it can affect how the reproductive organs form and function long-term. In males, decreased sperm quality, undescended testes, and genital abnormalities have been associated with early BPA exposure. In females, irregular menstrual cycles, polycystic ovary syndrome, often called PCOS, and reduced fertility potential have been noted. Studies on animals and observational data in humans suggest long-term reproductive issues linked to early BPA contact. BPA can also impact the immune system, which is especially concerning in children because, well, their immune responses are still maturing. Effects may include a higher risk of allergies, asthma, and inflammatory responses. It can even alter gut microbiota, which affects both immunity and mood. There's also a reduced ability to fight infections properly. Some evidence links BPA to higher rates of food sensitivities and autoimmune disorders. Even low-dose BPA exposure in children may disrupt metabolism, leading to increased fat storage, insulin resistance, which is a precursor to diabetes, and a higher body mass index, or BMI. BPA is considered an obesogen, meaning it's a chemical that can promote obesity. BPA exposure in adults, let's talk about the health risks involved. BPA, or bisphenol A, is a synthetic chemical that's commonly found in plastics and thermal paper, like receipts. It's actually a known endocrine disruptor, which means it can interfere with hormone balance and the many body functions that are regulated by hormones, even at really low doses. First up, hormonal imbalance. BPA is able to mimic estrogen, and that can really throw off hormonal balance in both men and women. So in women, BPA exposure may contribute to things like PMS, menstrual irregularities, fertility issues, and even early menopause. It can also make conditions like endometriosis and polycystic ovary syndrome, or PCOS, worse. Now for men, BPA may lower testosterone levels, reduce sperm count and motility, and even lead to erectile dysfunction or decreased libido. Studies have shown that BPA can disrupt the endocrine system even at low doses, which impacts not only reproductive health but also metabolic function. Next, let's look at the increased risk of hormone-related cancers. BPA exposure has actually been linked to a higher risk of breast cancer, prostate cancer, and ovarian cancer. These types of cancers are often driven by hormones, and BPA's ability to act like estrogen can encourage the growth of hormone-sensitive tumors. Thyroid dysfunction is, well, a significant concern when it comes to BPA exposure. BPA may interfere with thyroid hormone signaling, which, controls things like our energy levels, metabolism, mood and focus, as well as body temperature regulation. So what are the symptoms of thyroid disruption? They can include fatigue, weight gain, brain fog, and even depression or anxiety. Research has shown that BPA affects the hypothalamic pituitary thyroid axis, which can disrupt proper thyroid hormone production. Now let's talk about cardiovascular health risks. BPA may increase the risk of high blood pressure, heart arrhythmias, and atherosclerosis, which is the hardening of the arteries. In fact, one study found that people with higher urinary BPA levels had significantly higher blood pressure after handling thermal paper receipts. Now let's talk about insulin resistance and type 2 diabetes. BPA exposure has actually been linked to disrupted glucose metabolism, which unfortunately increases the risk of insulin resistance, weight gain, and type 2 diabetes. BPA may also interfere with pancreatic beta cells and insulin signaling, so it's really important to be aware of these potential effects. So let's talk about fertility problems. Both men and women are at risk here. For women, BPA can affect egg quality, ovulation, and even the uterine lining. And for men, BPA reduces sperm count and quality, which really impacts fertility. Increased BPA levels in the body are actually associated with higher infertility rates in couples. Now, since BPA affects estrogen and thyroid hormones, it may also influence mental health and cognitive performance. This can mean depression, anxiety, memory problems, and poor concentration. Wondering how to reduce BPA exposure from receipts? Well, you can say no receipt or just opt for digital versions instead. Try to avoid using hand sanitizer or lotion before touching receipts, since those can increase BPA absorption. Always wash your hands thoroughly after handling receipts, and don't store receipts in wallets, cars, or bags, especially in the heat. If you handle receipts regularly, like in retail, it's best to use nitrile gloves or advocate for phenol-free paper. Thank you for watching. Please like, share,